All right, another type of cancer we're going to talk about is multiple myeloma. This is cancer of plasma cells in the bone marrow. And basically what happens with multiple myeloma is that these tumors are going to devour the bone tissue. And as it breaks down the bone tissue, then it's going to migrate over to the organs, and then you're going to have an organ invasion. Um, Etiology for this, like a lot of our other cancers, we don't always know the cause, but the things that they have figured out is that it does have a strong link to certain occupational exposures. So you've seen this with people that have worked around like asbestos, for example, or individuals who have high exposures to working with like formaldehyde. Lots of occupational exposures are known to link to multiple myeloma. So signs and symptoms of multiple myeloma. So we're mostly gonna see bone pain, okay? So as these tumors devour the bones, you're just gonna have overwhelming bone pain. We're gonna see low-grade fever, malaise. Something very common is spinal cord compression, especially as it gets into the spinal column. So as those vertebrates start breaking down, they could compress on the spine, which can cause various levels of paralysis. You will see pathological fractures, which means that the bones will just basically disintegrate on their own. They don't have to fall to have a fracture. I mean, you can see the bones just break with even moving the patient up in bed can cause broken bones. Now, because we have devouring of the bones, it actually is going to push calcium out of the bones into the bloodstream. So the patient will also experience hypercalcemia, which means they have high calcium levels in the bloodstream, which could precipitate cardiac abnormalities. Okay, so you could see cardiac issues. And then this patient does have cancer as well, so they're high risk for infection too. So diagnosis for this, we're going to look at a CBC. You'll see your white blood cell count. We'll look at the electrolyte levels, especially that calcium level. You can do x-rays of the bones, so you can see the pictures of what these bone devouring tumors look like. 50% of your patients with multiple myeloma will have a urine specimen that will show Bence-Jones protein, so you may want to get a urine specimen on your patient. But as with all of our other cancers, the only way to definitively diagnose is going to be with a bone marrow biopsy. So you'll do a bone marrow biopsy to confirm the diagnosis of multiple myeloma. Therapeutic interventions. So this has a very, very high mortality rate. And so a lot of what we're going to do with multiple myeloma is going to be towards symptom management, okay? So steroids will help with the inflammatory response. Chemotherapy and radiation can shrink down tumors, which will actually help with a lot of the pain. We want to control their serum calcium levels, so that may require us to do some interventions based on that. Stem cell transplantation, if they catch it early enough, they might be able to get some benefits there. And then they also do IV irradia to help with the bones as well. But I'm going to tell you the 5-year survival rate with multiple myeloma is not very good. So the majority of patients actually will employ these interventions for symptom management. Okay. Nursing diagnosis for this patient: high risk for infection, high risk for injury. That could be related to the fractures. Like I said, this patient has pathological fractures. So something as simple as moving this patient up in the bed can fracture their bones. Complications of immobility, so pressure ulcers, DVTs, pneumonia, all things that we're going to be watching. And hypercalcemia. So we're going to monitor their calcium levels in the blood and make sure that we control the calcium levels as best as we can. Oops, that's what I wanted to talk about there. For the calcium levels, we make sure that we encourage fluid intake. That will help with the calcium levels. Sorry guys, I've lost my spot on my slides. And make sure that if we do have issues, maybe watch telemetry if we're talking about a patient in the hospital. IV hydration is one of the best ways to control hypercalcemia in this patient. And if they can do oral fluids, we want to push fluids as much as we can. Okay, that wraps up multiple myeloma.